Welcome to Pharmacology lectures. Today we are going to start case studies about pharmacodynamics. First case study is, if 1 mg of lorazepam produces the same anxiolytic response as 10 mg of diazepam, then which statement is correct? Statement 1 is lorazepam is more potent than diazepam. Lorazepam is more efficacious than diazepam. Lorazepam is a full agonist and diazepam is a partial agonist. Lorazepam is better drug to take for anxiety than is diazepam. And now we have to see the amount of the drug we are given. Amount is 1 mg of lorazepam produces the same effect as 10 mg, which means that lorazepam is required in smaller doses than diazepam. So lorazepam is more potent because the amount of drug required is less than the diazepam. So option A is correct. Next, which of the following best describes how a drug acts as an agonist at the A subtype of GABA receptors, affects signal transduction in a neuron? Now the GABA A receptor is a ligand-gated ion channel which is selective for chloride. So when agonists for the GABA A receptors are present, then it will increase the openings of the channels, which will result in chloride entry into the neuron, and thus hyperpolarization will occur, which will eventually lead to decreased action potential events. Option C, activation will open the ion channels and the chloride will enter the cells and decrease the chance of generating an action potential. Next, 10 mg of oxycodone produces a greater analgesic response than does aspirin at any dose. Which is correct? Oxycodone is more efficacious than is aspirin. We can see here that 10 mg of oxycodone produces a greater response than does aspirin at any dose. So here we are talking about the response. So the option A is correct, that it is more efficacious. We are not talking about the potency. Next, in the presence of propranolol, a higher concentration of epinephrine is required to elicit full anti-asthmatic activity. Propranolol has no effect on asthma symptoms. Which is correct regarding these medications? As you know, propranolol decreases the effect of epinephrine, but the inhibition can be overcome by giving a higher dose of epinephrine. Propranolol must be a competitive antagonist. That is option C. Epinephrine is an agonist and propranolol is a competitive antagonist. Now, if we'll have a look at the option D, even very high concentrations of epinephrine would not be able to elicit a maximal effect in the presence of propranolol, because propranolol has no effect by itself, and A and B are also not correct. So option C is the correct answer. Next, okay, in the presence of picrotoxin, diazepam is less efficacious at causing sedation regardless of dose. We are not talking about the dose. Now, picrotoxin has no sedative effect even at the highest dose. Even in the higher doses, it will not give this effect. Now, which of the following is correct regarding these agents? Picrotoxin is a competitive antagonist? No, it cannot be in this case. Picrotoxin is a non-competitive antagonist. Yes, because picrotoxin decreases the maximal effect of diazepam regardless of its dose, so it is a non-competitive antagonist. Picrotoxin has no efficacy alone, so C is not correct because it does not have any efficacy alone, and about potency also information is not provided here. Next, haloperidol, chlorpromazine and clozapine are antipsychotic medications that bind to the D2 subtype of dopamine receptors. With the binding affinity of haloperidol is most, then next is chlorpromazine, and last is clozapine. Which statement would have to be correct to conclude that the mechanism of antipsychotic effects for these drugs is via binding to D2 receptors? Now we can have a look. Option A, haloperidol should have lowest potency of the 3 antipsychotic drugs. Option B, D2 receptor binding should also be related to the potency of these drugs in causing Parkinson, like it was given. C, a positive correlation should exist between the affinity of these drugs to bind to D2 receptors and their potency for antipsychotic actions. Yes. To conclude that the mechanism of antipsychotic effect for these drugs is via binding to D2 receptors. So there should be a positive correlation between affinity for D2 receptor and their potency for antipsychotic actions. Haloperidol should have the highest potency and clozapine should have the lowest. Now, if there were spare beta 1 adrenergic receptors on cardiac muscle cell, which statement would be correct? If there were spare beta 1 receptors. Spare means only a fraction of total receptors need to be bound to elicit a maximum cellular response when spare receptors are present. So, option A, the number of spare determines the size of the maximal effect. No. B, spare receptors make cardiac tissue less sensitive. No. A maximal effect of epinephrine is seen only when a portion of beta 1 adrenergic receptors are occupied. Option C is correct. Next, which of the following upregulates postsynaptic alpha 1 adrenergic receptors? Postsynaptic. As you know, upregulation of receptors occurs when receptor is activated lower than normal, such as when the receptor is continuously exposed to an antagonist for that receptor. Down-regulation of receptors occurs when receptor activation is greater than normal because of continuous exposure to an agonist. So the correct answer is D, because of daily use of prazosin, which is an alpha 1 antagonist.